It's
Thank you, Asante. Congratulations, good people. Yes. We are preparing legislation for you to do what you must do for Kenyans. Asante sana.
representing WHO and representing all the development partners to witness this historical moment of signing these very important health bills. Mr. President, little less than 10 years ago, I was called back in my country of origin, Guinea, to serve as Minister of Health to help bring to an end the worst disease outbreak in that sub-region of West Africa, the Ebola disease outbreak that started in Guinea, spread to Liberia and Sierra Leone. It was very severe. It was bad simply because the health system was not resilient in all its components. In terms of surveillance, the surveillance system was not ready at all, and we all know the importance of community-based surveillance, the ability to detect unusual events happening within communities, recording that, and transmitting that. The infrastructure was not appropriate. Human resources were not adequate in terms of quality and quantity. Diagnostics was not where it needed to be. In fact, the diagnosis was confirmed in Lyon, in France, not even in Guinea, not even in Africa. The supply chain was not where it needed to be. Your Excellency, I'm bringing those up simply to say that by signing these bills today, you enable the health system in Kenya to be resilient and ready for those challenges. It was bad. 33 out of our 38 districts were hit with 67% mortality rate. We lost 115 healthcare workers to Ebola. Again, you enable the health system today to be resilient and ready for such challenges. And I would like to congratulate you on behalf of all partners. Your Excellency, I'm not going to deliver a speech. I just want to say one simple word about the fact that you bringing health to the communities, wherever they are, whoever they are, ensuring equity here and leaving no one behind. And those bills are in alignment with the Sustainable Development Goals, specifically SDG 3. And in terms of process, you've made it very clear consistently that health is a priority of your political agenda. And that message has consistently been conveyed by the Cabinet Secretary, Susan Nakumicha, her principal secretaries, the Director General, and technical services. In terms of inclusion, us as development partners were always invited, we were consulted, we were at the table, so we were part and piece of this whole process, and we would like to thank your services, the department, for that inclusion, for that great partnership. Beyond that, we also witnessed that other departments were invited. Every time the Ministry of Health is organizing an event, other departments are invited. That ensures synergy, complementarity, and cohesion in the governmental action because health is at the center of development.
Your Excellency, we are in discussion and in Kapkatet yesterday, we made a health workforce Kericho declaration. And one of the things that we agreed, Your Excellency, is that in the next 24 months, we are going to have a harmonious working relationship with all the unions so that we ensure that we deliver on universal health coverage. We have many other issues or clauses in the declaration, and we have given ourselves timelines because each one of them must be achieved. The second pillar of universal health coverage is on health commodity security. We have made tremendous effort towards progressing that. While we began with ensuring that we reform Kenya Medical Supplies Authority, and I can confirm to you, the board that we have, the leadership that we have is now on track. And last week on Friday, you yourself witnessed what the team has been able to do. Your Excellency, when we came into office, the fill rate for orders that have been requested by the county governments was at 40%. As we speak today, Your Excellency, I have received feedback from many counties that we are now headed to 70%. And that is how we are working, Your Excellency. We are focusing on local manufacturing. We have brought all of them together, and we are working together to ensure that we achieve that you have given us to achieve. Your Excellency, the third pillar was on technology, that we ensure we leverage on technology to provide healthcare or health services to Kenyans. We have worked very hard. I must acknowledge that that was one of the most difficult pillars, but we have made a headway. That we now are sure that we are going to create a superhighway where all facilities can connect into and be able to provide services. But Your Excellency, the most important bit about the digital bill that we decided, that you have ascended today, is that now as a country and as a sector, we can collect real-time data and use that data to make effective decisions that affect the health of this country. And Your Excellency, again importantly, that now we are going to network facilities into a primary care network using the digital technology that has been provided. We have worked very well with support from my colleague, CS Owalo, who has ensured that infrastructure has been laid in facilities, and we are now on the second layer of ensuring that we operationalize those facilities, Your Excellency. The fourth and last pillar, Your Excellency, is the one on on health financing. We have made a lot of progress. And today, signing of these bills, the social health bill, Your Excellency, as a woman, as a mother, as somebody with health information or who has been in the sector, this is the day that the doctors say that the mother who is pregnant is quickening. We have started now kicking as a ministry because we know that with the social health bill that you have now ascended into law, we are going to move forward, Your Excellency, because there are 3 funds that we have created in there. The primary health care fund to ensure that the primary level is publicly financed. The social health fund, Your Excellency, for many years, and many Kenyans have given us feedback that they were not able to know what is it that they are covered for. Despite paying 500 shillings, they did not know what their benefit is. We have worked with the team, Your Excellency. Now we are clear on what is the benefit as soon as you make your payment. What is it that you are entitled to?
Your Excellency, I didn't think I needed to say anything because you speak on our behalf. But let me take this opportunity because I'm here to salute the members of the National Assembly and the Senate for the expeditious manner in which they had these bills that you have today assented into law. Your Excellency, we continue to applaud the 2 houses of Parliament for the support they are giving to your administration's legislative agenda. Your Excellency, what now your assent means is that we who work under you have everything to do to implement these laws in turning around the healthcare architecture for the benefit of the people of Kenya. But I would like also to take this opportunity to say, much as Parliament has worked very hard, the CS of Health and her team have worked very hard. Your Excellency, your personal leadership in this matter has been very momentous. For the last 1 year, you have chaired countless meetings that gave birth to these bills that you have today assented into law. You have been very keen and categorical that a healthy nation gives way to a prosperous nation. So the journey that we have started today with the assenting of the bills will turn around the healthcare architecture for the benefit of the people of Kenya. And Your Excellency, I want to confirm that I have been around the country, and since your launch of the community health promoters with 100,000 kits, the impact of that intervention, Your Excellency, is already being felt on the ground. And the focus on preventive medicine as opposed to curative medicine will ultimately save this country on the health bill. There is data and research has shown that the cost of curing a disease is 9 times the cost of preventing one. So Therefore, Your Excellency, this intervention in another 4 or 5 years will also bring down the cost of the health bill. Let me also take this opportunity to thank the county governors and their county governments for the way they continue to work closely with the national government, health being a devolved function, and I have no doubt in my mind that this collaboration will continue so that these laws can have an impact for the people of Kenya.
Where we are today is not the achievement of a single person. Very many people have made sacrifices, huge contributions. They have gone out of their way to get us to where we are today. And in a very particular way, let me say that the people of Kenya spoke loudly, unequivocally about their desire for a system or a medical system that leaves nobody behind, where families do not lose their property or their savings because of illness. And I want to say I'm a very proud Kenyan today that working with many people, and they have, many of them have stood here, Turanira there, Mwai, Lea, those people, they have worked with me for the last 2 years. We put this thing together for the campaign. We didn't know that we were going to have it for the laws of Kenya. And they have patiently worked with me, as Susan confessed, in many boardrooms in this building. Before the elections, they worked with me in another place. And then after the elections, they worked with me here. The members of medical fraternity working at the Ministry of Health. Kwanza tuwapigie hawa watu makofi jameni. In record time, Parliament discharged its responsibility. And two things happened. We chose first that as we developed the laws at the final stages, we invited the two committees, at least the leadership, to participate with us so that they could bring their insights, they could bring their advice on board, so that by the time we finished the pieces of legislation, Parliament understood where we were going. That was step one. Step two, I also want to congratulate the creativity of Parliament. That on the bills that started at the Senate, members of the National Assembly who still thought they needed to be fine-tuned, gave the amendments they wanted to their colleagues in the Senate. And those in the Senate gave their colleagues in the National Assembly whatever amendments they thought would improve the quality of these pieces of legislation. Again, that demonstrated patriotism, creativity, innovation in how we discharge our responsibilities as Kenyans, but much more specifically, the creativity of our Parliament. Congratulations, members of Parliament. Wacha niwaulize wabunge wetu wakiongozwa na leader of majority wa Senate na National Assembly. Tafadhali msimame tuwapigie makofi jameni. Thank you very much. Through you to your colleagues in Parliament, the people of Kenya appreciate the kind of sacrifice and commitment and input you have made. I cannot forget the two speakers for their wisdom. Both these two gentlemen are great leaders. Thank you very much. I know we spoke often on what needed to happen, and they provided guidance together with the clerks of our National Assembly, Njoroge and Nyegenye. I want to say thank you very much, gentlemen. Your contribution is immense, and we don't take it for granted. Since independence, significant efforts have been made, but we have never quite gotten where we've always wanted. But that is changing today. We have reached a pivotal moment in our quest to reshape our healthcare delivery system. Today, 4 crucial bills for the implementation of universal healthcare have become law. These laws, together with various policies, strategies, and regulations that will be subsequently implemented, including the community health policy and primary health care and health financing strategies, will lay the firm foundation for the biggest change in our healthcare system ever witnessed. In the Kenya Kwanza Manifesto, we committed to achieving universal health coverage using various instruments. Number 1, we say there must be a fully financed primary healthcare mechanism comprising preventive, promotive, curative, palliative, and rehabilitative services. We also undertook that there will be integration of ICT into our healthcare ecosystem to enhance telemedicine, health management, information systems, mobile health, and especially the portability of health records, as was explained here by Mudomi Njuki, when he said that health records are in all manner of shapes. They are in pieces of paper, exercise books, foolscaps, and all manner of paper. But now, with the laws that we have passed, you just need to identify yourself, and the doctor can pull out your health records, diagnose, know what kind of medicine you've had before, know what kind of condition you've suffered from before, and be able to assist you going forward. This opportunity also, we said, we must ring-fence healthcare funds using facility improvement legislation. And that is the legislation, the FIF legislation we've signed today into law, both for national government hospitals that are referral and even for all the other hospitals down to the village. This is to protect money that we collect from healthcare facilities not being used to construct pavements or gates or other pieces of infrastructure, but so that there is adequate resources to make sure that there is replenishment of health commodities, there is improvement of health facilities, and that we enhance the quality of delivery of our health systems. The enactment of these laws, the Primary Health Care Act 2023, the Digital Health Act 2023, the Facility Improvement Financing Act 2023, and the new Social Health Insurance Act 2023 provide a legal and institutional framework for a new dawn in our healthcare system. With health insurance coverage at a low of only 26% nationally, Out-of-pocket costs are decimating families and keeping sick people away from treatment. The new Social Health Insurance Act will now address financial barriers to healthcare and the existing challenges faced by NHIF by establishing the Social Health Authority. This law will repeal the current National Hospital Insurance Fund Act and establish 3 new funds as follows: the Primary Health Care Fund, the Social Health Care Fund, the Emergency, Chronic, and Critical Illness Fund. These funds will ensure public-funded primary health care, emergency care, and universal health insurance, while also promoting equitable access to quality health services. The Primary Health Care Fund will finance services from health facilities at level 1 to level 3, while the Social Health Insurance Fund will cover services at levels 4 to 6. The Emergency, Chronic, and Critical Illness Fund will fund emergency and chronic illness costs once social health insurance is depleted. This fulfills the express wishes of Article 43(2) of the Constitution, which provides that no Kenyan should be denied emergency medical services. As you're all aware, this has not been the case so far. The Primary Health Care Act addresses the current health imbalance in Kenya by emphasizing preventive and promotive health services. The Act introduces a framework for the effective delivery of primary health services through networks that include all healthcare providers, whether they are public, whether they are private, or even faith-based. Kenyans have voiced their desire for change in healthcare, highlighting high costs and limited access to curative services. In response, we are committed to a community health approach that emphasizes prevention and promotion. Less than a month ago, we flagged off the kits that over 100,000 community health promoters will use in our counties. Tomorrow, during the Mashujaa Day celebration, we shall unveil these promoters and deploy them countrywide. Each community health promoter will be responsible for 100 households, and they will have kits and phones to enable them work effectively, efficiently, and in an accountable manner. The national and county governments will share the responsibility of stipends for the promoters, and our goal is to bring healthcare directly to Kenyans' doorsteps, significantly improving accessibility and affordability. The Facility Improvement Fund Act will counter the decrease in funding for public health facilities which often lack the requisite levels of investment, leading to a lack of autonomy, fragmented services, and poor outcomes. This law will entrench financial and managerial autonomy to enhance decision-making, efficiency, and community involvement in the management of facilities. While some counties have attempted to ring-fence health funds, only 26 out of 47 have succeeded. The Act provides guidelines to ensure a unified approach to facility autonomy, enabling them to independently retain and manage funds, ultimately improving resource availability, quality of services, and also enhance efficiency in the delivery of health. The Digital Health Act will streamline the adoption of technology in the health sector, enabling improved data sharing and resource utilization. This law will address the existing legal and regulatory gaps in the framework for e-health ecosystem and its data lifecycle, enabling the development of standards for the provision of mobile health, telemedicine, and e-learning in matters around healthcare. It has the potential to personalize patient care, improve quality, and empower communities. Our national healthcare journey has been long and at times painful. Indeed, most Kenyans have always insisted healthcare is the public service that they want the most. It is their number one priority. Today, we have made a significant step towards making healthcare universal for all Kenyans. I thank and commend the people of Kenya for actively shaping these laws through various public engagement platforms. I also thank, as I have said, the Council of Governors, county governments, development partners, and there are many. I know this event was convened at short notice. There are many development partners who have come through and supported us in this endeavor. And of course, the National Assembly, the Senate, our collective body of parliament for doing a fine job. These laws will transform healthcare in Kenya. They will save lives, empower communities, and make us a stronger and a healthier nation. Congratulations to everybody. We will be seeing off the community health promoters tomorrow. I wish you well. Asanteni sana. God bless you. Na tuonane kesho. Thank you.